name is Karen Garby, and I'm an interventional radiologist. I think I've wanted to be a physician my entire life. I don't remember thinking about anything else. Science and biology was always my favorite subject, so it's fascinating to me, and so it was something I always wanted to learn. Very interesting. So I went to school in Georgia, and I went to residency in Kansas City, and I did my interventional radiology fellowship in Cleveland, Ohio. I started out in a big radiology group, and there I helped start a interventional clinic in our group, and started gravitating towards treating vein disease, DVT, venous insufficiency. I also gravitated towards women's issues and began doing uterine fibroid embolizations, and then also dealing with ovarian vein embolizations, and that kind of goes along with pelvic varicose veins. So I was doing most of that when I left that group with Dr. Rainwater, and we decided it would be more rewarding to go into a clinic that just did interventional radiology. I enjoy the patient care. I really feel like I can help these patients feel better with minimally invasive procedures. They don't have to get big surgery and general anesthesia, and it's very rewarding because a lot of it is outpatient. They leave the office feeling better, doing better, happy, and it's all about quality of care. When I was in a residency doing my radiology residency, the rotations that I enjoyed the most were actually doing procedures, because it was very satisfying. You could do a procedure and make the patient feel better by the time they got off the table. And so I enjoyed the interventional radiology part, and plus we got to do minimally invasive procedures with all this fun, fancy equipment to help guide us. So that was the most interesting part of radiology to me, so I decided I wanted to do interventional radiology. The other thing is, interventional radiologists, we have patient contact. Other radiologists don't have as much patient contact, and that was obviously more enjoyable to me, to be able to talk with the patient, get to know them and their families, and then be able to help them with a procedure. So I enjoyed interventional radiology. When I became, when I joined the radiology group, then I helped start the interventional radiology clinic there, and my interest just was certain procedures were more gratifying, more fun to do, honestly. The procedures I was interested in, I saw pretty quick results in the patients, so they got symptom relief pretty quickly, and that was very gratifying. And I just kept getting more and more referrals for those type of procedures. And so when I decided we would go into the IR clinic and leave the big radiology group, that was what I concentrated on. In a big radiology group, you don't always get to say what you enjoy. You are doing procedures. In the case of a radiologist, you're doing a lot of reading of imaging, which may not be as satisfying because you don't know the patients. You're reading a CAT scan or some sort of imaging on a patient you've never met before. You don't know the rest of their history or all of their symptoms, and interventional radiology was just much more rewarding because you got to know the patients, you got to know their families, and you got to see results pretty quick. You knew what happened to them, whereas reading an imaging study, you never knew what the outcome would be. So interventional radiology was much more rewarding. So to be able to do that full time instead of only part of the time in a big radiology group was much more, had much more job satisfaction.